they're very susceptible at that time period, obviously, to teratogens. And then our fetal development happens. So again, like around week 12, that's when the kidneys start secreting urine. Week 24, the baby can hear. So again, they say talk to your baby when it's in your belly, or play music, things like that. Week 32, so that's when we have subcutaneous fat that's deposited. So when we think about a baby born possibly at 28 weeks, right, it doesn't have that subcutaneous fat on it to help it develop and have thermal regulation. We can also have issues that happen to the baby. Congenital will be present at birth. So environmental issues like inadequate nutrition, alcohol exposure, smoking, STIs. So again, we look at things like that to try to prevent environmental exposures. A lot of birth defects are from teratogenic exposure, but some can be genetic. Also medications, so things like warfarin and Tegretol. Infections like cytomegalovirus, rubella, Zika can all lead to disorders as well. These are just the different layers and what they end up developing later on in life. And again, you can see here the embryo. So again, the chorion develops from the trophoblast, and then the amnion from those blastocysts cells. It's important to understand amniotic fluid, right? So that fluid that the baby is swimming around in, right? It helps to maintain body temperature. It helps serve as a waste repository. It helps to cushion the baby. It helps to prevent tangling of the cords. It also helps with fetal lung maturity. So you can see there's a lot of things that it does. We look at the average amniotic fluid, so what's inside that sac, is anywhere between 700 to 1,000 ml. So about a liter of fluid that we have inside that sac. Now, the first trimester is when the amniotic membrane starts to produce that fluid, and then the second and third trimester is actually produced by the fetal kidney. It's a clear fluid. It's contained mostly of water. It also contains some proteins, some carbs, some lipids, electrolytes, and vernix. Now, we would be concerned with either too much or too little. So oligohydramnios is less than 300 ml. So that's not enough amniotic fluid. And just think about it. It makes sense in your body, right? If your kidneys don't get enough fluid, you're going to have kidney problems, right? So the same thing's going to happen to the baby. If they don't have enough amniotic fluid, they're going to have renal abnormalities. Just like in polyhydramnios, if they have too much fluid, they're going to end up with GI issues. Umbilical cord, gotta know it. AVA, the name Ava, my niece, right? 2 arteries, 1 vein. So when we think about the umbilical cord, it's about 55 centimeters long, about 2 centimeters in diameter. You can see by this cut picture here, there's some squishy stuff inside called Wharton's jelly. Wharton's jelly serves to help protect those blood vessels in there so they don't get compressed. That umbilical cord is very soft. You grabbing the umbilical cord can actually stop the flow of the blood to the baby. We talked yesterday about the nuchal cord, the cord wrapped around the fetal neck. Sometimes there can be knots in the cord. And again, only 1% of babies, but I did get to see it one time ever, have 2 vessels only in them, and that's considered an abnormality. The placenta, so this serves as metabolic exchange. When we look at this, it weighs about 600 grams at birth. It has hormones that it produces during pregnancy to support the fetus, and is responsible for things like circulation, respiration, nutrition, excretion, and storage. It allows the good and the bad to pass, right? So bacteria, drugs, caffeine, all can pass through it just the same as the good stuff that we get. Fetal circulation is very different. It's opposite of our circulation. So deoxygenated blood leaves the umbilical artery and enters the placenta to be oxygenated. And then oxygenated blood leaves the placenta via the umbilical vein. So again, deoxygenated blood leaves through the umbilical artery to the placenta. Oxygenated blood leaves the placenta through the vein and then enters the fetus. So when we're thinking about that, we want to remember our fetal circulation. HCG, that's the hormone of pregnancy. So again, about 8 to 10 days after conception, you can take a home pregnancy test and have the urine show the HCG level. Again, it reaches its maximum level about 50 to 70 days after pregnancy. When we think about viability, so what's the likelihood that that baby could survive, that fetus could survive outside of the uterus? And we generally say sometime between 22 to 25 weeks. Now you're gonna have some, my baby was 21 weeks and it survived sometimes, but I can tell you from experience in the NICU, even 22 to 25 is being very generous. I would say 28 more on my side, but we look at that ability for that baby to survive. Again, when we look at fetal circulation, remember your ductus arteriosus is what allows them to bypass the lungs. That ductus venosus, which takes the blood from the UV to the IVC in the liver. The foramen ovale, which is that opening in that left atrium. And again, thinking about week 4 is when that tubular heart begins to beat. And weeks 4 and 5 is when it starts to develop its chambers. So again, when we're thinking about that baby. So again, this is just a picture showing you that circulation and the shunts that are in place. NCLEX practice, so the nurse is preparing to teach a prenatal class about fetal circulation. Which statement should be included in the teaching plan? Select all that apply. The ductus arteriosus allows blood to bypass the fetal lungs. One vein carries oxygenated blood from the placenta to the fetus. The normal heart rate is 160 to 180. 2 arteries carry deoxygenated blood away from the fetus to the placenta, or 2 veins carry blood that's high in carbon dioxide and waste products from the fetus to the placenta. Select all that apply. B.
Is that B one?
B is one of them, yes. So we have one vein, because again, remember A, B, A, one vein, and it carries oxygenated blood. Remember, it's opposite of our circulation.
Just said A was the bypass of the lung.
Yep. A. So A, B, and what was the last one?
D.
D is in dog. Yep. So 2 arteries carry deoxygenated blood. So again, opposite of our circulation. All right. Again, our greatest risk of teratogens in that first 8 weeks of pregnancy. We have our brain developing. We have our heart developing. So we're worried about that during that time period. Twins, 1 in 43, although it's probably even increasing more nowadays with all the fertility drugs. Pregnancies result in twins. So again, if you remember, identical twins. One egg divides and forms the 2 twins. They're always going to be the same sex. 2 girls, 2 boys, okay? They share the same genotype because it was one egg, always going to be the same sex. Now, fraternal twins have 2 mature ovum that are matured by 2 sperms. So 2 separate eggs, 2 separate sperm. So you can have a boy and a girl. Somebody asked, could you have a girl and a girl? Yes, you could. But the only time that you're definitely going to say that it has to be 2 girls and 2 boys is definitely going to be a done.
So does that mean they have 2 separate placentas as well? If they're assured to be 2 separate?
So some have 2 placental sacs, and then some have a shared placental sac. It just depends. It's going to go way more into detail than what we need. It just depends on the type of twin. There's the di and the di and the other one. All right. Last one. So we're going to start talking about anatomy and physiology of the pregnancy. Alright, so gravida is a woman who's pregnant. Gravity refers to the pregnancies. If someone's a multi-gravida, that's 2 or more pregnancies. If they were prima, that's their first time being pregnant. So you'll see some of these terms used when you go to your clinical. When we think about it, it's important to understand what's considered preterm, what's considered postterm, and what's considered term. Now, sometimes you may see in different organizations, like Mrs. Costello and I talk about in all of the literature books, 38 weeks to 42 weeks is considered term. Where she was working at a hospital, they considered 37 weeks term. So sometimes you may see that variability from organization to organization. But if you look at any organization regarding pregnancy or the pediatrics, they recognize term births as 38 to 42 weeks. So preterm. Preterm, remember, is after 20 weeks, because before 20 weeks, what is it considered? An abortion, okay, spontaneous or elective, right? So preterm is 20 to 37 weeks. Term would be 38 to 42, and then beyond 42 would be considered post-term, okay? Again, we look at viability about 24 weeks on average. I gave you that kind of range before. Again, when we look at this, again, we say viability, the ability to survive outside of the uterus, but even then at 24 weeks, they only have about a 50% survival rate. So again, thinking about that. And this picture here is a picture of one of my girlfriends when her son was in the NICU. So you can see he had to have respiratory support and obviously fed through an OG tube. All right. Remembering your GTPAL. Again, gravity stands for what?
Pregnancies.
Number of times pregnant. Do twins count as single or double in this number?
Single.
And then term would be what weeks?
38.
Preterm? And abortion? Before 20 weeks. All right, and then L stands for the number of living children. So here's a practice question for you here. The nurse is collecting data during the admission assessment of a client who's pregnant with twins. They have a healthy 5-year-old child who was delivered at 38 weeks, and they do not have a history of any kind of abortion or fetal demise. Using GTPAL, what number should you note in the client's chart? Two, yes, because twins count as 1, and she has 1 child that was delivered that's now 5 years old.
Maybe B. Maybe B.
She's currently pregnant now.
Yeah, so she took 1 that's been delivered to term, right?
So sometimes it helps when you see it to write it out, right? So she's pregnant now, and she had a baby at 5, that's now 5 years old that's living, right? That one that was delivered at 38 weeks, so it was term. And then she has not had any abortions or fetal demise. So because she's still pregnant, we don't put anything in these boxes here because we don't know if that baby right now is going to be term or preterm. So again, when we look at this, she'd be a G2, T1, P and A's are 0s, and L is 1, so the answer is B. So again, practice these type of questions because again, not only on your exam next week, not only on your final exam at the end, but these are on the NCLEX, okay? Alright, pregnancy test, so again, bless you, when you have this, you want to try to use, if possible, the first void of the day is the most effective when you have that. HCG levels are at their highest. Remember, anticonvulsants, tranquilizers can give false positives, diuretics can give false negatives. If someone has low level that starts happening with their HCGs, that could mean an impending miscarriage or even an ectopic pregnancy. So when they come to the doctor, they can take a serum level to check as well. Alright, it's important to understand the difference between these three signs, right? Presumptive, this is when you presume something, right? So, as the woman, you could not have your period. Well, you could presume to be pregnant, or you could, just be late this month, right? You could feel tired, so you could presume to be pregnant, or you could just be getting the flu, or be stressed out, or whatever it is, right? So these are just presumptive, you're presuming you're pregnant. Now, probable, that's felt by the provider. So maybe they have Chadwick's, or Goodall's, or Hegar's. Maybe they've taken a pregnancy stick. Remember, there can be false positives. And so again, looking at that. The only one that we know for sure as a positive sign of pregnancy would be something like an ultrasound. So being able to, see that baby, see that beating heart. If you feel the baby moving and can hear the fetal heart tones, those would be considered positive signs of pregnancy. All right, the uterus. So when we think about it, when can we start to palpate, or when can we start to feel it? So about 12 to 14 weeks of pregnancy, it's at that symphysis pubis. About 22 to 24 weeks, it's at their belly button, right? And at 38 to 40, at the xiphoid. So sometimes when women experience what's called lightning, or as the fundal height decreases, as the fetus starts to descend into the pelvis closer to birth. When a woman first becomes pregnant, they'll go see their provider every 4 days, every 4 weeks, would be a lot, right? Until week 28. Then they start to come every 2 weeks, and then from week 37 on, they'll come every week. During that initial visit, they're gonna calculate their estimated due date. They'll go through pregnancy histories. They'll get a CBC done. They'll get screenings for STDs. And again, anything after 40 weeks, they're coming twice a week even. So you'll get your assessment done, weights, blood pressures. They'll measure that fundal height. So again, looking at the measurement of how high that fundus is. And assess the fetal heart rate. Women can start to officially show around 14 weeks. You may experience, again, that falling sensation or lightning between weeks 38 to 40. You can start measuring fundal heights around week 20. So again, as you remember, I told you about 22 to 24 weeks is when it gets to be about the belly button range. So again, as you measure from 20 weeks on, it'll measure the same centimeters as the weeks pregnant, give or take 2 on either side. So if the woman is 24 weeks pregnant, they should measure 24 centimeters or 22 or 26. So again, you can go in either direction. And again, some women experience quickening. It feels like a fluttering feeling. Some people say it feels like gas. I say it felt like when you go over a hill and your belly kind of drops, but you get that feeling about 14 to 18 weeks. You'll get some discharge. Again, a thin, colorless, non-itching, non-odor vaginal discharge increase is normal. Okay, that does not mean they have an STI or any kind of issue going on with them. It's just an increase in vaginal discharge. Again, as long as it's thin, it's colorless, it's odorless, it doesn't itch, right? Because any of those other things could mean to us that it's an STI. Pregnant women are also more susceptible to yeast infections, so again, being cautious of that as well. Breasts start to enlarge, and they may experience stretch marks on their breasts. In the second trimester, they may start to produce colostrum, and that's kind of like that yellowish color. Sometimes it's just enough to put on the tip of a Q-tip, but again, it starts to happen then. Cardiovascular wise, the heart starts to enlarge. We get blood volume increase of 1,500 mLs. Our cardiac output increases 30 to 50%. Again, we're looking at anemia. Again, anything less than 11, we're concerned. We also want to remind mom of positioning, right? So we don't want mom laying on her back and having the weight of that pregnancy compress that inferior vena cava, okay? So we wanna encourage moms for side lying position, while they're pregnant, to help with that. The ligaments of the rib cage expand. We have changes in mechanical function of the lungs. The diaphragm itself will raise up 4 centimeters for that fetus to have room. Your chest circumference increases 5 to 7 centimeters. You can have an increase in congestion during pregnancy as well. It causes an increase in tidal volume and a decrease in PCO2. Again, your respiratory rate usually doesn't change during that time. Sometimes you can have different skin issues. So the mask of pregnancy, you can see in that picture, you get just like a hyperpigmentation across the cheeks, nose, and forehead. You can get a linea nigra, again that line that kind of runs up and down in the belly button. We saw one yesterday in the video on the one mom. They can also get stretch marks, so that can occur. They can get vascular spider vessels that occur. You can get blotches on your palms that occur as well. And then musculoskeletal wise, again, relaxing of those pelvic joints, some low back pain. Sometimes women go up a shoe size, again, during pregnancy. We talked yesterday about morning sickness, but again, most common in that first trimester. We also want to be cautious with women that experience pica craving, so craving ice or clay or laundry detergent. It could indicate that they have an iron deficiency, so we want to make sure that they are not eating things like that. Some women experience heartburn. Sometimes there's that wives' tale that says if you have heartburn, you're going to have a baby full of hair, and it was true with my Jack, he had a full head of hair when he was born. And again, increased urinary frequency. All right. Any questions on that? All right, so for the remainder of class, we are going to pop into Nurse Achieve. Get ahead, get plugged in. You can work with a partner if you want. We're going to go into the NGN, RN, Nursing. Yours is S4, mine is S2. And we're going to go to the case studies. We're going to go to maternity and labor.
Where's case study?
It's just under, when you first get in, it's under that Q-base.
Oh. Right here? Oh, I didn't. And then what do you want us to click on?
And then I want you to click on health and physical assessment. And I want you to change it to 2 cases. And then generate.
Case studies. The S4. And Scroll down right here. Oh, yours is touchscreen. That is fucking me up. Go back.
Are you in Google right now?
Yep.
Have you ever been able to get it?
No, still click that bottom. And then scroll down the bottom. And go number of cases with 2.
Well, usually like I don't know 28 hours like that. I would make it like when you I'd make them walk up by the secretary because the internet's so much better up there. Alright. If it gets to be an issue though, like if it still acts up like that, it's not easy.
Oh, I did this yesterday. Should I just give you all the answers? Yeah. Pretty sure hypertension. Yeah, if you check her vital signs, it shows it on there. I think.
Oh, I messed up.
And